Please be seated. Thank you, Jesse. I would just a little bit of Rotary business and to explain a little bit of the flow today. We are going to break the program up into two separate sections. Tony Knorr will be facilitating as moderator for the panel. The first part will be Rotarian Paul Hansen, President and CEO of Sanford Sioux Falls, and Andy Muntz, Director of Operations for Sanford here in Sioux Falls. So they'll begin the program, and then we'll move in to Kelby and Bill Gasson. I would like to take a moment to ask all of our guests today to stand and be recognized. We will not call you out individually, but if I could have all of our guests stand, please. Welcome. Thank you for being with us. Thank you so much. All right. I think with that, Tony, I'll invite you up along with Paul and Andy to begin the program on the important subject of COVID.
And welcome fellow Rotarians, guests, members of the media, and those that are joining us online. Today, we are going to talk about the merger. But given where we're at with numbers, with trends, we thought with an integrated health system here, we needed to talk about where we're at, current state of affairs, and excited to have Rotarian Paul Hansen and Andy Muntz join us today to talk through essentially where we're at, and let's start with trends and capacity. We're making national news for reasons that we don't necessarily want to. Help us understand where you're at currently in terms of capacity and how we sit here today.
Yeah, thank you, Tony. Can you all hear me? Okay. Okay, great. Well, first and foremost, we've learned a lot since last March, right? I think all of us can say that personally and professionally that, where we're at today versus where we're at back in March with this pandemic, hitting the U.S., there's a lot of differences in opinion, but certainly, we've got a clear road for where we're going to go in the future. I think in terms of, capacity and our ability to take care of folks, here in the Sioux Falls market, I want to say, first and foremost, again, this is our job. This is what Sanford does. And, as we move forward, with our contingency plans, that we had in place even prior to a pandemic, certainly one couldn't, predict a 9-month pandemic in terms of where we're at right now. But I will tell you that our people have been prepared for something like this, all along the way. As we look at the numbers, strictly the numbers, as we look at the Sioux Falls marketplace, I want you to consider how large our marketplace is right now. We have the tertiary center here in Sioux Falls, which many of you know as Sanford USD Medical Center. That's 500 beds. We have 26 other facilities within the state of South Dakota, southwestern Minnesota, and northwestern Iowa that we also are part of our family. We also have a very large post-acute partner that became part of our Sanford family in Good Samaritan. And that has been an instrumental key, portion of our ability to be able to take care of people in terms of getting people out of the hospital and putting them someplace safe. So as we look at our numbers, again, last May we saw a spike in our numbers, and we saw and heard about that spike within the local press in terms of our ability to be able to take care of folks, or is there going to be a need to send people out of the state of South Dakota? There was not. There was an opportunity for us when our volumes were dipping a bit back in those months, specifically April and May. There were some within our industry that were looking at that, and they laid or furloughed people off. We did not. We took an opportunity for us to invest in our people, to look at what this virus could do in the future, and we felt that the best investment we could make at that time was reinvesting in our people and upskilling our people to assist us in the event that we would need more employees, for a higher volume. What's happened within our market, within Sioux Falls and within the outlying areas, is you're seeing a higher number of inpatient, census. But, one could argue that during this time of the year, November, December, and certainly, January, the flu season, we get full. So our numbers today, for example, we have 400 people within the facility. 105 of those patients are COVID patients. So 25%. And certainly that's up more than it was back in May, but it's a number that we can handle. And we can handle that because as we look at utilizing our people, as we looked at making that investment back in May and June and upskilling our people, we have the ability to take care of those with our own and not rely on a lot of agency help, coming into our operations. And if you're listening to the news, especially on the East and West Coast, they brought in a lot of temporary help, a lot of agency help to help them, and we just haven't really done that. So I think from my standpoint, when you look at Sanford Sioux Falls and you look at what that means in its entirety, and you think about the 600 physicians, the 500 APPs, the 8,800 employees that we have in place, they're doing a great job. Are they tired? Yeah, they are. It's been 9 months. It hasn't been a flu season of 2 to 3 months. It's been 9 months of this type of work. So we're listening. We've got contingency plans in place. We could talk about that. I'm going to have Andy talk a little about our contingency plan that we have and the impacts that we have, what we do to maneuver around the needs of certain specialty help in this area, and how we help ourselves. I will say this as well too. I think that it takes courage to look at making investments in keeping people when others are not. It takes courage to make investments into certain supplies, specifically in this particular case, PPE, personal protective equipment, when others were not making those types of investments. It has secured the ability for us to take care of the people we need to take care of, and that is the service area that we see, which is South Dakota, Southwest Minnesota, and Northwestern Nebraska. I'll add more to that, but just I want you to understand that yes, it's tight. Yes, we have people that are tired, but I also want you to understand that it's our jobs. This is what we do. So with that, I'll turn over.
As you're handing the mic to Andy, let's talk modeling preparation for further surge with cases. Then hospitalizations follow that. What is the health system doing to prepare, and what do you see? How do you see this playing out in the coming months?
Yeah, as Paul said, and he teed it up nicely, is we've learned a lot through this pandemic. Clearly what we knew in March is different than what we know now. And that's really changed. And I think that's one of the beauties of our team here at Sanford is we can be nimble and we can react and plug in really where we need to. What we learned is, and what we saw across the country, we didn't shut things down per se here in South Dakota, but across the country as things were shut down, that resulted in a delay of care. And that's serious consequences for patients. You look at cancer diagnoses and screenings and things of that nature. So really our duty and obligation to the community is how do we keep that going? Because healthcare doesn't stop. It's not elective that I sign up and say, hey, I need a procedure or a screening. It's just that's what happens. That's part of human life. So how do we balance that with then some of the COVID volumes and other volumes? And truly we are seeing, as Paul talked about, some of our volumes, as our volumes have been high, I truly believe, and we know that a fair amount of that is because people just delayed care. So now what is that message? That care is safe, it's the right thing to do, and it'll actually prevent you, say, a longer hospital stay in the future if you take care of some of that basic care now. So we're really working on balancing that. The models have also changed, as you reference models. I mean, everyone, I think, remembers the first couple models that came out in March and April, where we're talking 1,800 inpatients in South Dakota, and that's changed for a reason. We didn't know a lot about COVID in March. Now, and some of the things I want to talk about a little bit after this question is some of the exciting therapeutics that we have, and with the vaccine coming along, there's some true light at the end of the tunnel on some of this, and we're just able to manage these patients differently now. So when you think about models, really what we're anticipating, what we're seeing through some other national models, is that in South Dakota here, really over the next couple of weeks, we're probably going to peak at where we've been. Now there's a lot of assumptions that go into that, but based on current state, that's what we would anticipate, and we're definitely confident that we can handle that volume and through all the stuff that Paul talked about. So with those staff that have been upskilled, I think a great example is as we talk about hand hygiene, social distancing in schools where they're wearing masks, we're seeing a lot of less pediatric illnesses right now. And honestly, a lot of those staff are who we've upskilled, to Paul's point, that are now helping to partner with some of our adult caregivers to keep people in the community. I mean, what's the worst thing that could happen is you have to, not provide the care, or Paul, your mother or father has to go out of the state to receive care out of Minneapolis, something like of that nature. We're caring for him here, and we truly believe that's our duty and obligation to the community. So we feel good about that, and really over the last couple months, we've been setting up for this, knowing that this is where we're going to be.
We've talked about the team from a staffing standpoint. How do you feel in terms of maintaining the health of your employees and being able to handle this uptick?
Sure. Okay, I'll take that one. As Paul said, we have been busy. It's, every day though, you also hear stories to the contrary where people are rallying around each other. And honestly, that's what makes me so proud to be a member of Sanford's organization. We have areas like I was giving examples of pediatrics, but say in laundry. So we have someone come over, the maintenance crew comes over and helps out the laundry department and folds laundry, and they're actually having team building events around it. And as an organization and as a region here, we're also having conversations of even what sense of normalcy can we help provide some of our staff. So, another great example is some of our folks that work in our COVID units are going to have a night out at Great Shots and have some of that normalcy back, the team building, some of those types of things, as there's the human component to this, and people are, clearly incredibly stressed. But as a health system, what resources can we provide them to give them, the resources they need to feel human, to feel normal again, and we're working really hard on that.
Yeah, great, Paul.
I think I'm just going to add a couple things to that, and that is, to go back to the normalcy piece. We've given increases to our employees, on schedule. We've given some special, one-time gifts, if you will, to our employees. We've tried to create other opportunities to engage in other discussions at all levels with our employees, especially during this time. We know it's stressful, and so we've increased our ability to access the employee assistance program for a number of employees who, maybe are the lone breadwinner for the family. And I think the biggest thing that comes to my mind is we went out and we looked at an employee crisis fund, and we looked at it from the standpoint of not only Sioux Falls, but as a system. Because what this really did for us is it reinforced the fact that we need to have some additional resources for our employees when there's that unforeseen thing that came up. And we were able to raise almost $1 million from our employees, to the employee crisis fund. That gives you an indication in terms of the type of culture that we have, because during a time like this, when things are tight, they're still willing to give a pretty large, percentage of what they make. So we're very proud of that as well. That culture is a big piece of Sanford Health.
Yeah, that's great. And you mentioned we're 9 months into this. None of us really know where the finish line is with this. If there is one, it seems to keep moving. But let's talk about where we do have optimism. There's reason for hope. Last week, I believe Pfizer announced their results of their vaccine. I think Moderna earlier today. You want to talk about what that looks like? And on top of that, the state announced that we are expecting to get doses here in South Dakota within the next 30 to 45 days. Talk about your preparation. Talk about what that looks like for those most vulnerable, and then also for our Rotarians. When can we expect to stand in line for a vaccine?
Yeah, first of all, we're learning as we go as well. So a lot of the information is new to all of us at the same time, right? I just heard a stat though this morning before I came over here that Sanford has the capability, the refrigeration capability of taking about 1 million doses, of the vaccine, which is significant. And so we stand ready to say to the state, we have that capability. So, use us if need be, right? I think the other thing too is I'm not going to get in the clinical. I'll let you take the clinical piece, Andy, I promise. But I think operationally speaking, when you look at, the distribution that format that we're going to have and the communication piece that we're going to have, that coordination is going to be held by and between, our people that know what they're doing, with the state, with the health systems that we have in place. Certainly, the elderly will be, one of the first that we targeted for the vaccine, healthcare providers, emergency providers. But everything that I've seen looks to me, it could be the first quarter of next year, right? For the Rotarians, us.
Mhm.
So I'll let you take the rest of it, Andy.
Yeah, thanks, Paul. I think you hit most of it. As we talk the vaccines, I think really we're anticipating, and this is in collaboration with the state and others as well, as really by the end of the year, the next few weeks, we should have some vaccine available really for those high risk populations, and then also the healthcare workers that directly work with COVID patients. So I think to your point of having some positive news and light at the end of the tunnel, this is big. And the last really releases regarding the efficacy and the effectiveness of these vaccines is very encouraging. To have both of them over 90% is something to be very, very excited about, quite honestly. And I think as healthcare providers, harnessing that with some of the new therapeutics that are being utilized, it is an encouraging time.
Yeah, which is fantastic. Thank you both for joining us today and talking about the current state. Like you mentioned, there's anxiety, there's fear out there, but hopefully we can balance that with, like you said, a light at the end of the tunnel with vaccine and some of the therapeutics that you're treating your patients with. So with that, I'm going to ask Jason to come back up, and we'll go ahead and make a switch here. Thank you both for joining us.
Thank you very much. Well, our next guests really don't need an introduction, but we will give them one, the proper one. So our two panelists here today, of course, are Kelby Krabbenhoft and Bill Gasson. Kelby, with an unwavering commitment to the health of patients and a visionary approach to care, Kelby has helped transform Sanford Health into a national leader in medicine, research, and innovation. During his more than 2-decade tenure, the president and CEO has led the system through dynamic growth and development. In 1996, at age 38, Kelby was named president and CEO of Sioux Valley Health System, which then employed only 6,339 people and operated 18 hospitals, 30 clinics, and 9 long-term care facilities. With legacy heritages that span more than a century, Krabbenhoft brought together regional health systems based in Sioux Falls, Fargo, Bemidji, Minnesota, and Bismarck, North Dakota, to form Sanford Health. Soon after joining Sioux Valley, he launched an integrated health plan that now insures more than 200,000 people. In 2019, the health system merged with the Evangelical Lutheran Good Samaritan Society, the largest not-for-profit post-acute care provider in the United States. The organization now includes 46 hospitals, 210 clinic locations, and 158 skilled nursing and rehab facilities across 26 states and 10 countries. With 50,000 employees, Sanford Health is the largest employer in the Dakotas. Bill Gasson, Chief Administrative Officer. As Chief Administrative Officer at Sanford Health, Bill is responsible for the organization's day-to-day operations and performance. He oversees human resources, technology solutions, legal, facilities, business development, and the Sanford Sports Complex. Bill began his career at Sanford Health in 2012 as corporate counsel and transitioned to the Human Resources Department 2 years later as Vice President of Human Resource Integration. He later served as Chief Human Resource Officer before his promotion to Chief Administrative Officer. Prior to joining Sanford Health, Bill spent 4 years in private legal practice. He holds a bachelor's degree in criminal justice and a law degree, both from the University of South Dakota. Please join me in welcoming Kelby and Bill to Rotary today.
Thank you, Jason. Welcome, Kelby and Bill. And thank you all for being here today, and for those that are joining online. I want to say thank you too for following safety protocols, wearing masks. Both Sanford and Rotary strongly encourage that. We talked about it beforehand. The three of us, in full transparency, have already been through COVID, and we do not believe we're a threat currently to either you or to each other. So we're gonna conduct this
Not
interview
relative to COVID.
right.
Yeah.
We're going to conduct this without, but we got a lot of ground to cover. A big announcement here a couple weeks ago. But my first question is going to be directed towards Kelby. Jason provided your bio. You've been part of this system for 25 years. Many of us in the room have been part of this community for decades. Others maybe just recently joined our community. Talk to us about your vision for integrated health and the path that you've been on over the last decade plus, and kind of set the stage for our discussion today.
Sure. Well, I think it'd be way out of line if I didn't hearken back. I think whether Bill Byrne or Dan or a lot of the guys in this room, a lot of folks, men and women, it was 25 years ago where I sat on stage with Lyle Schroeder, and Dan gave the opening, I think, to introduce me to the community. That's the last time I've been up here.
Welcome back.
So quarter of a century, and after that introduction, I wanted to say, could we have some applause and call the meeting? I don't know if I can add to that. I appreciate that very much, but it's still the same as far as the vision goes. And Mr. Kirby and Mr. Everest brought me here with a committee of people 25 years ago with a simple mandate that was to build a system and go beyond what the great and incredible leader Lyle Schroeder had accomplished, and take it to that next level. And right away we started talking about the importance of where healthcare was going in terms of cost, our role in addressing that issue, and then never wavering from the standpoint that our core business was to guarantee that people had access to really high quality, consistent, reliable healthcare. And that just hasn't wavered an inch. I can't tell you, Tony, how important the aspect of trust is when you're talking to Central Plains Clinic. Some of you might remember Central Plains, or Fargo, or Bismarck, or Bemidji. The notion of growing a system and creating a vision for people, knowing that the corporate office was going to move from their communities to here. And the level of trust, and then the willingness of a board, and the promises that we needed to make and then live up to in terms of delivering what their expectations were in Fargo and in Bismarck and Bemidji and all these places. So it kind of, for me, as far as a vision is, and that's overstated. I don't have any magic ingredient there. It's common sense and good business principles and ethics and those kind of things. And I think living up to promises and then following through on that strategy was what it was all about. There's a pretty sophisticated element to the strategy, because with the health plan, we need to be able to make ourselves available like an insurance company to provide people with care and insurance coverage that they can depend on. And in our organization, for example, I think 4 out of the last 5 years we've either reduced premiums or held them to zero. That's never said. It certainly doesn't get covered.
Mhm.
But that's 50,000 people who don't have health insurance premiums going up. And yeah, we have to get creative with deductibles and copays, and we work with our employees to talk about that and what they value and what they want. But that's our end game.
Mhm.
And I think we'll be in a really good position to do that. What's required is a geographic coverage that you can do what I said, which is a guarantee that people who live in Bison, South Dakota, have the same expectation of access to health care as people who live on 18th Street here in town. To do that, you can't get yourselves in a United Nations negotiating position every time you got to go out and try to get to a price point or get to some quality standards. You have to, in many ways, you have to control those assets.
Mhm.
And that comes with the interpretation or the perceptions of growth and size and significance. But it all comes back to a real basic formula.
Yeah, maybe talk about what in that period, it seems like things have accelerated the last decade. What has taken more time than you expected, or maybe what has gone faster in terms of the path forward?
Well, when I look in the rearview mirror, the speed at which this organization picked up some momentum in terms of its growth happened about the same time as Mr. Sanford's gifts to us. I think the Children's Hospital and there was a wow factor that goes along with being in 10 countries and 26 states now.
Mhm.
I know, and I haven't shied away from bringing a little color to my job. Okay, so I realize that. I want people to understand it, and I don't want to get up here or anytime go into some admino speak industry jargon. But I think part of what has picked up speed is that momentum, and I think it's because of the intrigue of the research that we're doing. Still absolutely committed to a cure for type 1 diabetes. All of those kind of things, and we have some of the best talent in the country here. And to do that, I think has helped us grow, garner a reputation that I didn't really think could get accomplished in the first 25 years. I think in this business, it takes a long time. But it's picked up a lot of momentum there. On a lighter note, I'm surprised after this long, especially in this community, to be characterized toward the end here as taking a backseat or a lower profile. I was thinking on that, and I know that's what was covered with the merger columns lately. And I've been thinking about, it hasn't even been in that 2-year window that $1 billion merger was done across 24 states with Good Samaritan Society and completely turned their finances and secure them as an employer in this community and as a national leader. That was done about 19 months ago. And we did this little thing down in Iowa where I had to work at getting our company ready for that merger. I was at the altar. That's kind of like senior prom for me. But this is, it took a lot of work to get there, and the immaturity corporately and the problems that Unity Point had in Iowa, well, that's on them. But we worked really hard to get that done. That would have been an incredible merger. Great shots happened about a year ago at this time. Then this little thing out in Utah's going on. That didn't happen because we fell out of bed on Friday last week and announced it on Monday.
Well, let's talk about that, Kelby.
We are going to, but
let's talk about
Intermountain. These young guys here, there's been a work in place that really started, provoked by, I think, Ron Molquist and some other people, very, very importantly, to get succession going for our community and for our organization. And that's what you're seeing here. I inherited a great organization. Becky Nelson, Dick Bowie, Kramer, Soderholm, the whole gang. okay? And then I had a middle group that I worked with and kind of put my DNA on them. But then this crew is a hand-picked bunch. And I'm really proud to say that the board's asked for that succession plan. I've been working on it and making sure they're getting out there in front. These two, I hope, were inspiring at their professionalism. And then this little thing called the virus showed up last February. So it's not really been taking a second seat here. You know, and we've been very busy. The company's pushing $7 billion now with 50,000 employees. And that's my number one concern, Tony. I got people who think there's a lot of other things on my mind, and there is, but they're always the first thing. Because if those people are secure and they're steady, they're going to do a great job at the bedside. So that's always the first thing on my mind.
Yeah, great.
Now the merger.
Let's talk. You talked about the vision or the path that you've been on. Talk to us about Intermountain and how that either fits or modifies that path that you were heading down.
Well, there's 5 reasons boards will consider with their executive team a merger in healthcare, and not-for-profit sector. There's not a cash out. There's not a multiple of EBITDA or any of that you're going to get involved with. Currency is usually board seats. That's what, and they're just looking for security. Whoever's involved, for what their legacy, their culture, what's important to their communities. And in the case of Intermountain, the stellar reputation in both financial and significant steady integrity around their business practices is unreproachable. It's the finest in the nation. The highest bond ratings, $9 billion in reserves, and I had never met the leadership there, so I had a chance to meet Mark Harrison, who I hope will sit in this chair real soon, and talk with you folks. I got the sense right away about this issue of trust. He's a vulnerable person, a passionate person, extremely professional, well-trained. But then we started moving, and the first thing out of his mouth was, "I can't believe the depth at which you invest in your community." First thing. And boy, that resonates. I know it's an important issue in a room like this, but to me, it's resonated for 25 years. I think we've demonstrated that. They have an incredible international reputation for the quality of their medicine. It's largely driven by the data. Their doctors and their nurses aren't any smarter or better trained than ours, but they've had a long tradition of really deep data analysis on healthcare, and it's really moved them to a standardization, which is a cousin of quality, and they've achieved that. And as we started talking, the notion of this geographic guarantee that I talked about a little earlier, coupled with the end game to not only provide the absolutely most exquisite healthcare experience, the consistency and confidence that our employees can have because of the financial organization we can put together, but then how we grow as a second step to that came. And it's a remarkable comings together of two organizations that they don't have 220 nursing homes across the country. They don't have a research facility like we have. They don't have an investments in sports medicine and orthopedics at the level that we do. So all of these, they don't have the philanthropy momentum that we do. So there's a really good fit on their side of the equation. They have a really big health plan, and ladies and gentlemen in Sioux Falls in particular need to know, I mean, we have done a great thing with our health plan and our insurance company, and we are good at Division III in insurance. But this is a Division I world we live in. And to be able to get to millions of subscribers and members in your insurance company, we just simply aren't big enough. We're just not there. And we can't be because we don't have a national network for people who are very mobile. A lot of folks now that don't worry about the winter here, head off to the desert and vote against golf outings and things like that. But we find ourselves in a situation where to reach all those people that travel, we're going to have to get bigger in insurance and provide a national network. Intermountain brings that. The last thing I'll talk, because I'm blathering on here, they have a company called CivicaRx. It's kind of like Profile is for us, except they manufacture pharmaceuticals. One of the first things they're way beyond what they expected to do in terms of the manufacturing of medicines. They were going to only have a handful of drugs in like the 4th or 5th year now, and I think they're up to 46 or 47 pharmaceutical drugs that they're producing in mass, and shortages for us in terms of insulin, really important medicines. And we think we could come up with and they've shown me the trajectory of an insulin alternative that will really just drive that cost way down. And it's just an exciting time. The plant for that is in Virginia. So this is really a national play for us. It's an important one. The most important thing is the culture at the board level, the community levels. Their towns are no bigger than Sioux Falls. People think Salt Lake City's like Chicago. It's about a 70-mile city with one road going through it from St. George on up to Ogden or Logan, and their biggest medical center is somewhere in between Paul's shop here in town at Sanford and the one in Fargo. So very, very familiar kind of organization to us.
Yeah, well, thank you, Kelby. Let's talk. You brought up Mark Harrison. You brought up Next Generation. We have a lot of those leaders here. With your past mergers, and I'm going to cue this one towards Bill. With past mergers, Sioux Falls has remained the corporate headquarters. This one, what's been shared with us, is that's different. And a question a lot of our minds is, what does that look like? Mark Harrison as CEO, corporate headquarters in Salt Lake City. Talk to us about that and what that means moving forward.
Yeah, appreciate it, Tony. I'll share a few thoughts, and then Kelby certainly bat some cleanup on this one here. Excuse me. As stated earlier, one of the traditions here at this organization is that we've had Kelby at the helm for a quarter of a century. And so we've come to know and to trust and to rely upon that. And that's the biggest change here, to be honest with you, I think in our community, in the halls of the medical centers, is that we've always had that it's Kelby, it's Kelby, it's Kelby, whether it's an idea that at first pass everybody says it's great, or they say it's crazy. We've sort of just trusted on Kelby to deliver on that. But one of the things that Kelby did, gosh, it's probably nearing 6-7 years ago now, for sure 5 years ago, he publicly announced his intentionality around retirement. And that's part of the focus that he's pushed on this entire organization, is that avoiding being in a position too long, squatting. And if you do that, you get comfortable and you don't start forcing the group beneath you to start building and developing succession. And part of his very, very intentional strategy around succession allowed him to come out forward and tell everybody that was happening. So for us around Kelby's table, the fact that it's going to be Dr. Mark Harrison is the new information, but not the fact that Kelby was going to retire and no longer be the CEO. That caught none of us by surprise, because he'd been sharing that with our team on about a weekly basis, pushing us and preparing us in a good way to say, all right, tomorrow I'm not going to be here, figuratively speaking. What would you do? How would you respond to that? What would your reaction be? You're not always going to have me here to make these decisions for you, which has been really healthy for us around the table. It's pushed us to be better each and every day. And so now for us, it's sort of finally starting to happen. As Kelby stated, we've had an opportunity over these last 6 months to really get to know the folks in Intermountain, from their board leadership to Dr. Mark Harrison to the rest of his leadership team. And I think it's best stated, and it gets said probably too often, but there's such a similarity relative to culture. The state of Wyoming is all that really separates us. And the state of Wyoming looks and feels pretty similar to the world that we know here in the Dakotas. And they're focused on the same things we are. I know there's been some conversation and discussion around investment in the community. That's of the utmost importance to Intermountain as well, too. In fact, when Kelby made the decision, along with Paul Hansen and their other presidents in our other markets in Bismarck and Bemidji and Fargo, to invest in those who are in need of hunger, or those who need hunger relief, and made the decision to say, we're going to come out, we're going to give $3 million to those food banks, those food relief organizations within our states and our footprints that need it, because it's the right thing to do. It's the way that we care for our communities. As soon as that press release came out, Dr. Mark Harrison sent that to his board and said, I told you, these are our people. And it's those things, whether it's investing in youth programs here, maybe it's basketball there, they're invested in triathlons, they're invested in the ski teams out there. But at the end of the day, it's focusing on communities. Strong communities result in strong businesses, and that's what we're pushing in our communities. The stronger the economic setting is here in Sioux Falls, South Dakota, the better off we're going to be at what we do. That allows us to bring in the physicians, that allows us to bring in the talented nurses that we need in order to deliver on ultimately what we're here to do, right? Which is to deliver the absolute best care at the bedside as we possibly can, right? And if we're taking really good care of those people who care for people, then we'll be delivering on those promises. And I think that's what you're going to see out of Dr. Mark Harrison and his team, is the exact same culture and the exact same focus that we've had here. And I would say, even though that change is happening, what you see here today isn't going away. So the infrastructure that's been established here in the Sioux Falls community, as well as all of our communities, will remain. And if we're all doing our jobs well, you're going to see it grow. You're going to see that increase. It's going to be better tomorrow than it is today. We didn't enter into this because anybody had a hole in the side of their ship. The advantage of this merger is that you've got two extremely healthy, strong, vibrant organizations that are coming together, which is a bit unique in the industry. Whether it's healthcare or otherwise, oftentimes you see a failing company coming together with another stronger company to help bail them out. Here we get the unique honor of bringing two healthy, strong organizations together, and we don't have a problem to fix. Our problem to fix is that we're really good today and we want to be great tomorrow, and that's what we're going to focus on, and I believe that's what we're going to accomplish. And if we do our jobs right, everything that you see today that Kelby's established, that leadership is established, that Lyle Schroeder established, only gets better, only gets bigger as we move forward.
Yeah. Thank you. We talked early with Paul and Andy about the team that's here. You have 50,000 employees. I know you don't take any decisions like this lightly. We're in uncertain times. Your employees are probably wondering, hey, what's next? What does this mean for myself, my family? What has that messaging been to your team?
Yeah, good question, Tony. And first and foremost, I just lean on the comments that Paul and Andy stated, which is, I mean, we are so richly blessed to have the best care teams, I think, in the country. I don't care where you're at. I mean, the physicians we have, the nurses we have at this place, the technicians, everybody has a job to do in this company, and they do it extremely well. And I do want to thank them. We couldn't say it enough. We try to do it through consistent raises. We try and do it through bonuses. We try and do it through holiday gifts. We try and do it through notes or handshakes or a pat on the back, but it falls short every single time to thank them for what they do. We have got an incredible team, and yes, they've been tested. Yes, they've been pushed and have done incredible time here during the pandemic. But if it's 2019, 18, 16, it doesn't matter what it is. These teams do it all the time. Every one of you in this room who's had an occasion, you or your family, to come into one of our clinics or come into our medical center, you know that high level of trust and experience that we have there caring for us. And I just want to say thank you for any of them that are listening, and certainly to Paul and Andy, thank you so much for the leadership. Thank you so much for all that your teams do. And I think that's important, because that same level of care and expertise that you see today, you will see tomorrow. Again, we're not doing this to get smaller. We're doing this to grow, and not just in size. We look to bring new service lines. We want to bring new cares, new treatments to our communities that they don't have today. Through the health plan, we intend to bring new offerings that we haven't had an opportunity to do before. And that's just, as Kelby said, that's not lack of sophistication. That's not lack of want. That's just numbers, okay? There's a requisite level of investment you have to make to bring certain products to the market. Now combined with Select Health, that's Intermountain's health plan, we're going to have the size and the scale to bring new offerings to this market that provide new opportunities for our employers, provide new opportunities for those members and those individuals within this community. And so the message I want to leave with our employees is that we need you today, and we're going to absolutely need you tomorrow. We're going to need more of you tomorrow. We're never going to be in a position where we want less talent. And the same message that Kelby and Mark, I had the opportunity to listen to those two talk last week. Mark shared with his team, Kelby shared with us. This isn't some pursuit of seeing how many bodies we can cut out of an organization. Your jobs are secure. We want you, we need you, and we're gonna stand behind that. Kelby long ago established a promises made, promises kept culture. We've shared that with Intermountain. Intermountain has responded and reciprocated that with us as well.
Kelby, anything you want to add to that?
I'll just direct it to your question. I think one of the reasons I'm smiling about a couple of years from now is I think I'm going to make it into the end zone, never having had a layoff, a reduction in force, or compensation reduction for our people. And that's 25 straight years of that. And the people who sit across the table from me in Utah have the same feelings, have the same attitude. So I think the best predictor of future activity is probably to look at our past, both of us. And I would say for consistency of job security, of compensation, reward, and appreciation by us, I think that's, and it probably goes without saying, again, the board provoked it when I wasn't ready for it, but to come up with a succession plan. I mean, Matt Hawks, Micah Aberson, Bill Gasson, Dr. Louis Gomez or Garcia. You got a whole crew of people. I'm going to stop listing or I'll forget. But even in Paul's team, that succession is a really point of pride for me in terms of what they can expect, our people and the community. There's an understanding that there will be an eastern, what Mark Harrison calls an eastern frontier, and a western frontier to this system. We're simply too big to move it to Utah. They don't have a campus like we do here. It's a completely different setup. This team will stay in place. I'm hoping that some of our folks will move out there and that some of theirs will come here because the cross-pollination would be healthy for this community and our system as well as theirs. Those are some of the things in the details that we're working on that I hope resonate among business leaders here that make common sense to do.
Tony, I'll put just a punctuation on that. Kelby brought up a good point. Paul did too. And one of the unique bonds through the pandemic is that, well, very, very few health systems have done this. Sanford Health and Intermountain Health refused to furlough or to lay off a single employee. And that is why you heard Paul talk about today, why we're positioned today to be able to deliver the care that we need to. We're not calling people back who we sent home. They've been working for us the whole time, and we're still able to employ them today.
Yeah, that's great. Let's talk. Thank you for sharing that. Let's talk about the patients. We have members of the that would consider Sanford their primary care provider. I'm one of them. You talked about the 210,000 members here in Sanford. I believe it's over 900,000 at Intermountain. What does this mean for us, the patients, in the care that we receive?
You know, I think there's been a lot of discussion for so many decades about the cost of healthcare, and that for us gets interpreted in terms of what we pay our nurses, and you know, and that challenge is very difficult. And there's really not been any magic to that. Cost management in every business is real similar. The key for us is going to be able to bring a standard and a methodology to the care people are provided as much in their home, away from the cost-intensive environments, so we can really make sense of the premium being an insurer that they pay. So it all keeps coming back to that. There is just no way to escape the federal load that this is now, the indebtedness and Medicare and Medicaid are putting on budgets. There has to be a new creative solution. Just for people's understanding, this isn't an alien idea. Sanford Health today takes care of all of the employees and their families of the North Dakota State Employee Retirement System. That's 70,000 people, and they pay an annual premium of around $300 million for that. We have to take care of those people if they are retired and head to Arizona, or if they're up in North Dakota continuing to work. This is what states are doing across the country. The Medicaid is being handed over to usually one system to manage throughout a state or multiple state region. So this is a very common practice that's emerging, and they're finding, like we have, that you can go to 0% rate increases or a reduction in premium for people. So this isn't a crazy idea and a fantasy vision. This is very practically being done across the country, and it's a long march, but that's where we're headed.
Yeah.
Tony, I think I'd simply state there too that I know a lot of people in this room have entrusted us with their business for their employees. And under John Snyder, the president of our health plan's leadership, they're excited to serve you really well today, but much better tomorrow. And I do think that you can hold us accountable to that, and we will deliver on that promise.
Yeah, excellent. Let's come back to something you brought up earlier, and that's we've all been the beneficiaries of Sanford's investment in the community, nonprofits. I mean, across the board, there's not too many areas that you don't touch. Whether it comes to economic development, education, health and wellness, youth sports, I mean, the list goes on. As you work through this merger, what should we expect in terms of future investment in the communities that Sanford serves?
Well, we're going to be presenting our budget to our board here in 3 weeks, 2 or 3 weeks. An example of what's gone on out at the sports complex for so many things that I believe it just demonstrates our commitment to a healthy community. I mean, in this town, you get whole families that come to those events. It's not the one-off kid that you can just send to the empty parking lot to play baseball. I mean, sports has changed, and the security and the confidence parents do that their child is safe and in a good environment. It just got to be met, and that's one of the things I've committed to early. I think it should be said that one of those projects that's not on the list but will be by the end of the week is this building we call the Dig. I think some of the finest women athletes in the country are right here up and down I-29 and a few hundred miles east and west of it. And that's a volleyball center that would be similar to what the Pentagon has been. I think I want to make sure on my watch that statement is made to the incredible women athletes that are here. And they get through high school and then they get recruited away from here. So just like the Pentagon has been a magnet to keep kids here and keep families together, I want to move in that regard. But I'd also say the much broader commitment, just to correct the misnomer, I never went to one college or university and asked them if I could give them some money. They all came to us, and these community concerns, they all came to us. And then took a great deal of pride in saying I wanted to be aligned with many of the businesses represented here, and my buddy Dana Dykehouse back here is probably most predominant of all the things we've done. But with scores of businesses in the community that have supported the universities, the colleges, the causes that we all enjoy here. But I never wanted to be seen as someone who just did a little bit. I wanted our organization, if we were going to be a community leader, to act like one. And so we always stood forward and said, okay, we'll figure out a way to support you. And those kind of things have been going on a long time. This whole topic kind of comes with the irony of the vote that just happened around the Sanford International. because on one hand, the people that gather out there on Wednesday nights are concerned about the continuation of this that 25 years ago didn't know was going to happen, and then to vote not to extend it there because some tea times were interrupted for 7 days. It's a very difficult thing to swallow. But Fargo's going to really enjoy the International, and I think it'll be a big hit up there. And it's unfortunate, mixed message sent, mixed message received. So you guys knew I wasn't going to shy away from that.
Tony, it's a.
Thank you. Bill, you want to?
Yeah, no.
add on to that?
In addition to Kelby's comments there, I mean, we have talked about it and we will continue to make those investments in the universities and the schools, notwithstanding some of those challenges. It means a lot because it does create a healthier community for us, but it's critical when we start talking about our team, our staff, the caregivers on our team. I mean, that's that pipeline. That's where we build that through. Starting with the high schools, we get to know them. We start scholarshiping those kids coming out of high school. We scholarship them through college, give them the internships, give them the fellowships, and then bring them back here to work. And we're going to continue to do that. So for those of you here who either yourselves or your children have been beneficiaries of that, you can expect that we're going to continue to do that more into the future.
Yeah, which is great to hear. We got a couple of events coming up here that working on.
Yeah.
You mentioned the Pentagon. We're looking forward to hearing more about the dig. But talk to us a little bit about that. That's been part of the vision since the Pentagon, the field house, that we'd have events here that make national news, and this one is definitely in that category. Talk to us about how those came together, and as we move forward, given the trends, how do we ensure that those go off without a hitch?
Those are going to be great events, and I think part of just getting the momentum for Sioux Falls as a template for what we could do in our other communities was to get these kind of events and see the appreciation and the notoriety and the first-class nature that can happen here. And that's been exciting and fun to do. It's great for our employees, great for future workforce to want to work with us, because we try to give them a benefit in that. But we've got some great coaches showing up. Greg McDermott down at Creighton has taken on a real joy in grabbing the microphone and talking about the virtues of our organization and how it supports Creighton, but because we love their doctors, we love their students that come and work for us, and that we can have them here playing other great teams. I hope the community just loves it. It's what we did it for.
Yeah. Just to add to that, and we've got a great slate of teams and wonderful coaches and players that are going to be here during that time frame. And Coach Mack, I think, did a nice job when you talk about sort of why Sanford. In a recent interview, he explained that as a coach, he's focused on wanting to not only give his kids the best possible opportunity to be successful, to showcase their skills, but with everything going on, he wants to do it in a way that's safe, that takes care of them, that takes into mind their health and their well-being. And the fact that the Pentagon and the sports complex is tied to a health system, he stated, and I believe stated accurately, that we provide the best infrastructure for the safest possible environment for not only those athletes, but their coaches, their teams, and the fans who will be able to experience that as well too. And I think that's why. What we do is very unique because it's a part of an integrated healthcare system. There's lots of venues where you can dribble a basketball anywhere you want to around this country. But I don't think there's anywhere else where you're going to be able to do it in an environment like this. In a sports complex like we have, where you've got care teams there that are going to be ensuring that these kids are safe, that they're well taken care of, so they can forget about all those other things that are going on around them and just do what they do, practice their craft, give folks a break to enjoy watching sports. That can be a great reprieve for people right now with everything going on around them, and we're happy to bring that to people.
You know, Tony, when your hair is this color, I hope, and I know Dana and I talk about this, 10 years from now, our grandkids will be talking about, Bernhard Langer was here, or they saw Creighton play Gonzaga. I hope that's what we wanted.
Mhm.
Because with those little bit of inspirations, I mean, to see Steve Stricker and to see these guys out on the, to see these guys, the legends of the game, and not only in golf, but in basketball, but everything else. I mean, Chad Greenway trained here for a while. All kinds of folks now can be role models and really icons for that next generation of kids that we want to keep around here. And one of the reasons that we can do that is because, as Mike Begeman was telling me today, 5 and 10 years from now, the appreciation for this is really going to grow. And I hope it's not because we lost an event, that they talk about it in a kind of melancholy way. I hope the excitement can be brought back and we can keep it rolling.
Yeah, well, great. Well, thank you for sharing that. It's a big deal. There's not a lot of, I mean, teams are looking for games. We have the #1 team on the ladies' side. South Carolina is going to be here,
Yep.
and it's a strong slate across the board.
Yep.
And we're not going to get into it here, but I did hear a recent interview with Steve Young about the bubble environment that is being created to ensure safety. Let's kind of, as we're wrapping things up here, you've created an international brand. You talked about research. You talked about the reach. And a couple years ago, the Sanford Lorraine Cross Award, you rolled that out. My understanding is that had to be pushed this year into the spring. But maybe talk a little bit about what that means. Do you expect that to continue? And share with us what you see there.
Well, the design around the Lorraine Cross Award was to honor cures, finishing, not exploring a disease, but actually finishing it. And about 18 months ago, 19 months ago, we honored a couple of wonderful researchers, 2 women that had cured blindness from a disease called retinitis pigmentosa. They went on to sell their company right after that award for $4 billion. This year, real similar kind of thing was all slated to go. And we just felt the virus could, because of the activity right around the time when the vaccine's going to be starting to be rolled out, we might not be able to bring what we want is the attention and the focus toward curing things, getting things done in medicine. And what better time than to celebrate the fastest cure on record has ever been done, finding a cure for this virus and having a vaccine. So we wanted to bump it into the spring, and spring's beautiful around here. It'll show the world, another time of year in Sioux Falls, South Dakota. But I think you should expect that first of all is an unending event. We asked a small group of donors. I think Micah could tell us, but I think we're within just a couple of $1 million of having that completely funded. So the economic cost of the award of $1 million every other year and the event itself will be paid for by this philanthropic group of families. Many of them are sitting in this room. And Heidi and I are proud to be part of that. And I think it's a thing that, like the Nobel Award, because it's just singular, every other year to do that on an ongoing basis here could really create yet one more iconic sort of definition of what it means to live and be part of the Sioux Falls community, as well as this organization. So I don't see it ending.
All right, excellent. Thank you. Bill, you want to add anything to that as we wrap up? Any final comments?
Yeah, certainly. And just real quick, I'd be remiss, because I know it's a question that's sort of come up in few different settings here across the community, but you mentioned brand. And I'll just, to be real quick about that, without equivocation, the Sanford Health brand that you've come to know and trust here at home will remain. And I would love to tell you that we had to fight tooth and nail for that. But I will tell you that was immediately embraced by our colleagues over at Intermountain. And I would say if there was fighting that tooth and nail that happened, it's what's gone on since 2007. It's just been the hard work of investing and putting substance behind that name and behind that brand and what that means to our people. So that will continue. That does not go away. And that's not something that's at risk. That's been fully embraced and endorsed by our colleagues with Intermountain. And they say it for all the reasons that we know. Simply put, that's a name that's known, that's a name that's recognized, it's a name that's trusted. Why would we ever want to get away from that?
These are
Excellent.
serious times, Tony, with the virus and very sobering, somber times. But I want folks to know that the optimism that this team, myself, I know our partnerships with you and all the great friends we have in this community. There's an optimism. It doesn't border on an opportunity for humor today, but it's there, and there's a real momentum and an excitement because we got to get past some things. There was a time during the virus and COVID that we actually still had more tuberculosis patients in our beds than we did virus patients. Can you imagine that, guys of our folks of my age? We still have tuberculosis patients that outnumbered the virus patients just a few months ago. And now we can fast track cures for this virus. It has got to frustrate you as much as me that we don't finish the curative process much more vigorously and much more quickly on some of the things that take our families, that take our friends. And I'm just hoping, whether it's the Lorraine Cross Award, me being stubborn, I don't care what it is, that we really get about that. Because I'm really optimistic about healthcare in this country. I think it's the best in the world, and the people that provide it are doing God's work.
Yeah, excellent. Well, thank you for balancing that realism and optimism. I would just say, you plan to join us next Monday. We're going to have Dan Swartos from the South Dakota High School Activities Association, as well as Casey Miley, here to talk about, we're right in between fall and winter sports. So they're going to be talking about some of the challenges that they're encountering as we move forward with winter sports for our young athletes. So I really want to thank you, Kelby, Bill, for being
Thanks,
here
Tony.
today, sharing what this means, not only for Sanford Health, but for our community. We're so integrated, and it's important for us to understand as you move forward where you're going to be at and what we can expect. So thank you.
Thanks, Tony.
Kelby and Bill, thank you again for joining us today. And if track record is the best forecast, we have nothing but great things ahead of us. So thank you so much for being here. Everybody, Rotarians and fellow and guests, thank you for being with us, and have a great rest of the week. Thank you.